Julie Johnson, thank you so much. You've been a Democratic state representative and now you are running for Congress. Why and what is the rationale for your campaign?
Yes, I am running for Congress. You know, it's been an honor to be in the state house, but it's clear to me that we have a lot that needs to be done at the federal level. And I believe that I have the experience and the opportunities necessary to be the best representative for CD 32.
And what is the rationale of your campaign? What is it that you hope to accomplish? I mean, why are you running? What needs to be done in your mind?
Well, a classic example is healthcare. I have really focused on healthcare access in the Texas legislature. I've passed numerous bills that would improve people's opportunity to get the healthcare that they so desperately need. But state law only regulates 13% of healthcare in the state of Texas, and federal law really governs 87%. And so I want to take what I've learned in the state legislature, I want to take the deep foundations of understanding and experience I have of legislating in the healthcare space to the national level, because Texans are at a crisis for healthcare access.
And what are your other top priorities if you are to win this in not only the primary and the general election?
Well, the state of Texas needs so much, right? We are grossly uneducated. You know, we consistently rank in the bottom of educational opportunities and success. We always need to focus on jobs and improving access into the employment market. And that also comes with the educational space. Are we training the next generation of workers? Are we giving people the opportunity to get employment at a rate where they can support their families at a living wage? And are we also giving businesses the workforce that they need to continue to expand and create opportunity in the state? And then lastly, we really need a place, an environment in our country where everyone has the right to live their full life, where government isn't discriminating against their LGBT people, against people with disabilities, against people based on their race and ethnicity. And we really need leaders who are going to be champions of everyone's opportunity to fulfill their own American dream.
And taking your three top priorities there in the healthcare space, I mean, obviously you were in Congress representing, yes, North Texas, the 32nd Congressional District, but you're also voting on its national legislation. And so what would you like to see healthcare-wise that is not now in part of federal law?
Well, one of the things I've really focused a lot at the state level is removing a lot of the administrative burdens of access to care, such as prior authorizations. You know, these administrative limitations that health insurance companies put are really designed to keep patients from accessing the care that their physicians are prescribing. And so, for example, I just read a thing that Medicare, we need to remove these obstacles in Medicare. Remove these obstacles in federal health plans, these burdensome prior authorizations that really seek to put administrative hurdles in place where physicians can't prescribe and patients can't receive the treatment. That's one of the first issues I want to tackle right away.
Can that be done without adding to the cost of healthcare?
Well, absolutely. I believe that these burdens increase the cost of healthcare. You know, my wife is a physician, and I see firsthand in her own medical practice all of the administrative personnel that they have to hire to meet all of these burdens. When you seek thousands of patients and you have to go through a burdensome prior authorization process for every single procedure, every single prescription, that takes huge amounts of time. Most physicians spend way more time on the administrative requirements of meeting insurance demands versus actually rendering patient health care. And I think if we could streamline those and make them much more efficient, that would actually reduce costs and give our medical personnel much more opportunity to actually treat patients. And so they're not waiting for months and months for appointments.
Let's talk about jobs and workforce, which you mentioned. What more should and could the federal government be doing?
Well, we need to really encourage educational partnerships in the private sector. Are we providing the employees that employers need? Are we providing the skills necessary? And so really look and maybe reinventing how that looks. And we did a lot of that in the state legislature, especially with community colleges. really looking at technology programs and to make sure are we providing the training necessary. And then I think the next level for that is tuition replacement and grant opportunities in high demand fields. For example, the Texas legislature, we just passed in our budget opportunities for nurses to get tuition assistance and grant programs if they go into medicine in certain high-end, high-need areas that are underserved, to incentivize students to go that, because the cost of getting your education is very, very expensive. So many people can't afford that. And I think the federal government needs to step in and try to make college more affordable, not only for four-year institutions, but also more trade-based training. You know, we have a crisis of construction trades, for example. We are not getting people, incentivizing them to go become master plumbers and master electricians. And we just need more people in the workforce. And I think the federal government needs to step in and try to incentivize states and incentivize our university structures to provide these opportunities.
And then the other top priority you mentioned is helping communities feel as if, various communities, feel as if they are equals.
Yeah.
And so talk to me a little bit about that, and specifically, what do you think the federal government needs to do that's not being done now?
Well, I'm a proud member of the LGBT community. I've been married to my wife for a long time. I have 2 children. I've been very active in the LGBT community for decades. And I have never seen the level of hate targeted to the LGBT community in particular that I see right now. It's very, very disturbing. And there's this wave proceeding through our state legislatures where they're really aggressively targeting our right to marry, our right to love, our right to work, our right to seek health care. And so it's become very clear to me that the federal government must pass the Equality Act as soon as possible. And we have to prohibit this kind of discrimination against the LGBT community, period.
And what would the Equality Act do?
Well, it would prohibit discrimination based on LGBT issues on your status. And so right now, we don't have these same kinds of constitutional protections. And it will provide that you cannot discriminate, for example, in healthcare. Like, there's a bill in the Texas legislature, it's the Drop Dead You're Gay bill, that says a physician can refuse to treat you based on their belief structure on whether or not LGBT people should have a right to exist. That's unacceptable, and we cannot allow that to happen. The Supreme Court has given us the right to marry. There are definite groups operating out there, because it was done by the Supreme Court, that want to try to overturn Obergefell, similar to how the Roe decision was overturned. And it just needs to be fully protected once and for all.
So you're talking about codifying it in a federal law,
Yeah.
but are you talking about a constitutional amendment or just a law?
I don't know if it has to be a constitutional amendment, but the federal government needs to pass the Equality Act. It's been offered. The House has passed it last session. The Senate didn't get it done. It needs to get passed.
This may be a crowded field that you're entering, and I'm wondering, why do you believe you are the best Democrat for the primary and the best candidate for the general election?
Well, it is fundamental that for Democrats that we hold CD 32 to defeat Kevin McCarthy and get a House majority in the House. So how do you do that? Well, you have to have your most experienced and the best and the brightest that you have. I have already demonstrated that I can campaign really, really hard. I've flipped my seat. I've already know how to win an election, how to mobilize a base, and how to turn out voters. I also have the experience necessary, not only from my legal background of a long time of history of representing people, but just having now done 3 terms in the Texas House, I have a pretty good command of the issues, and I'm ready to get to work day one.
I wanted to ask you just about a couple of issues that we've seen in the headlines. How would you have voted on the debt ceiling budget cuts, the deal between Speaker McCarthy and President Biden and the Senate as well?
Well, I would have voted to increase the debt ceiling. We cannot have our federal government go into default. That is an unacceptable option. And so I would have voted to approve that.
And what about the budget cuts? I know that was part of the deal. You would have gone along with that.
Well, you know, I think it's responsible to have a responsible budget. You know, we do have to start to look at reining in some of our government spending. There is no doubt about it. But, you know, we cannot default on our national debt. That is an option that just cannot be allowed to happen.
And internationally, you know, foreign policy-wise, what country to you stands out as the most dangerous to the United States, as far as, you know, China, North Korea, Russia, Iran, for example? Or is there another country? How do you feel about the dangers that those countries face, and is there any one particular country that is more dangerous than the others that the United States really needs to be very concerned about?
Well, all the countries that you mentioned, North Korea, Iran, Russia, and China, are all very dangerous to the United States. And you could make an argument, actually, any one of those is the